Um, well, welcome to Gilda's Club Kansas City's fatigue workshop. We have Amy and Lisa here, and I'm going to let them introduce themselves here in a minute, but I hope that you enjoy our presentation today. And Amy, oh, go for it.
I was going to say, Amy, thank you. We certainly appreciate the opportunity to be here to talk to all of you today about cancer-related fatigue. What you see on the screen is kind of the agenda for today, and how we want to spend the next roughly 45 minutes with you is to talk about the problem itself, cancer-related fatigue, the interventions that are available, at least right now, in how to better manage through it. And we also want to do an exercise together, which is kind of, we call our base of energy, our energy measurement. And then we have a couple questions, as well as want to take questions from all of you at the end. But as Amy stated in the beginning, we have a rather small group, so feel free to add comments in the chat, especially as we're going through topics. Feel free to share your own perspective or experience, as well as be able to, ask any question that you may have, just so you don't have to wait until the very end. So we want it to be a somewhat engaging, and not us just talking to you the whole time. But with that, I want you to get to know us a little bit. Lisa, do you want to introduce yourself first?
Sure. Hi, everyone. I'm Lisa Marie. I am a family nurse practitioner, but more specialized gynecologic oncology nurse practitioner. So I come out of Boston. I worked at Massachusetts General Hospital as a nurse, and then at Dana-Farber Cancer Institute as a nurse practitioner. I moved over to the Netherlands for a personal move, actually, and luckily came across this wonderful company, Tired of Cancer. So I'm fortunate enough to be here with you via the Netherlands in Amsterdam today with Amy. So I'm super excited. Super excited.
We're happy to have you, Lisa. And I'm Amy Rosenblum. I'm the Director of Global Partnerships with the Tired of Cancer team. We are a Dutch company, very much a very small startup that has a mission to help every single cancer patient and survivor out there deal with cancer-related fatigue globally. And I live in Nashville, but I spent the past 2.5 years living in the Netherlands. And now that I'm back here in the US, we're really trying to focus our efforts to help educate, individuals, care providers, health insurance companies. Our focus is doing everything we can to help everyone know that there's a support tool out there for cancer-related fatigue. So with that, I'll get started in jumping in really to what we're all here today to talk about and better understand, and that's cancer-related fatigue. Cancer-related fatigue is the number one side effect of cancer and its treatments. And it ends up being very surprising for a lot of individuals, because it's kind of the invisible side effect in so many ways, in that it's not as visible as, say, nausea or hair loss. And Lisa, I wanted to ask you and get your perspective of, since it is the most common side effect out there, why don't more people hear about it?
Well, I think the problem is that it's the ongoing side effect that we don't have a quick fix or a specific fix for. So, when you're diagnosed, obviously fatigue, yes, you have cancer, you're exhausted. When we're giving you treatment, whether it be chemotherapy, radiation, hormonal therapy, you're tired, we're blaming the medicine. But I think the thing is that we really need to get better on, as globally, is that once that treatment's done, or even if it continues on to be a maintenance treatment, that this is a chronic thing, and fatigue is chronic, and that it continues, and that we need to validate that and accept that, and figure out a personalized plan per patient, going forward. And just knowing that this isn't it, to be 6 months from treatment, a year from treatment, or to be on maintenance treatment, you could still very well be significantly fatigued, and it just needs to be addressed better.
Yeah, absolutely. And we'll dig into that. A lot of the points you just made, Lisa, as far as, it's different for every individual, and it can last at varying points throughout someone's journey. So I think to start, it's always really helpful for everyone to kind of get on the same page as far as what is cancer-related fatigue. And the definition that the National Comprehensive Cancer Network has, and this is really kind of what we use, it is kind of the best way to define it, and that it is a distressing, persistent, subjective sense of tiredness or exhaustion related to cancer or cancer treatment that's not proportional to recent activity and interferes with usual functioning. This really, I think, kind of hits the nail on the head, so to speak, as far as the all-encompassing aspects of cancer-related fatigue, and that it's more than just being tired or being exhausted. I always like to ask people, how did you, realize it was cancer-related fatigue? Or maybe a lot of people say, I'm not really sure if I have it or not. So I want to go through the characteristics, because like I just said, it's not just being tired. This isn't something that can go away with an extra cup of coffee or maybe a nap. Cancer-related fatigue is something that can happen very suddenly without warning, not necessarily something that results after, say, physical activity. A lot of patients we've heard had said it's almost like feeling like you're unplugged, or that your battery has gone from 100% to zero. That kind of sudden aspect, and that it's also very extreme, to just suddenly go from feeling fine to people describe it as almost like hitting a brick wall. Mm-hmm. And that the recovery time also lasts longer. So as I mentioned, it's not just being able to take a nap. So I always like to go over these things and also ask you, do you see this for yourself? Is this something, are there specific characteristics of it that you've experienced? And of course, as we mentioned, you're welcome to share in the chat. I think it's always valuable to learn from each other. That's one of the number one things that we say, is that you're not alone. Everyone, may feel like they're the only ones going through it, but in fact, you're one of very millions of people out there that are dealing with the very same thing.
Mm-hmm. And I've had patients describe to me, it's like, pre-cancer, I used to say, like, I was starving. I was so hungry. But then post-cancer, like in relation to the fatigue, it was like, I didn't know what starving meant. And this is the type of fatigue that sort of we were talking about, like low blood counts, you get a blood transfusion, you take a nap, you feel better. Like this fatigue is the one that is long lasting. And we just had a question come in, and from post-treatment, how long does it last? So again, it's individualized, but I tell my patients that it's a minimum of 6 months to a year. And then in my particular disease group, which is gynecologic oncology, so that's the only specific one I can speak to based on research, but 48% continues post the first year. So sometimes it's sort of like, I feel like as providers, as nurse practitioners, as doctors, we're really good at saying, like, okay, your chemotherapy is going to cause neuropathy. It might go away. It might never go away. We're not very good at saying, this is going to cause fatigue. It might go away in 6 months to a year, and it might not go away. And this might be like a definition of a new normal. And how do I live with that? And how do I go forward with that type of thing, I guess.
Yeah, as much as we'd like, a concrete, definitive time frame, that's not always the case. And obviously everyone's different in terms of the type of treatment. Sorry, it looks like I'm trying to get our slides to move forward. There we go. Everyone's treatment's different. Everyone's obviously cancer type, stage, all of those things factor into it. It's also talking about describing it and the impact. We have a word cloud, and this is really from patients who've shared their own experiences with us and how they classify it. And so I always want to hear from you, as far as when you look at this word cloud, are there words that you would describe it as that aren't here, or is there particular ones that are especially relevant, for you? And again, every individual is different in terms of how fatigue impacts them, and again, how long it lasts. All of those elements, it's different for every individual, but you see here life altering, debilitating, overwhelming, the, drowsy, isolating. It's there's so many different ways to describe it and the impact it can have.
Someone just shared annoyed, which totally I agree. Another one that I think of is chemo brain. A lot of times, people will say, I have chemo brain. It's a real thing. And I've sent many people for neurological workups, and it's at the end of the day, it just seems like this fatigue is contributing to that. So I would actually add that to the list as well.
Yeah, good point. So again, going and discussing more about impact that fatigue has, there's kind of three core areas that cancer-related fatigue impacts, and one is the physical limitation, so not being able to maybe be as active or participate in the same physical activities as you once did. There's the social invalidation, so not being able to perform the same tasks or duties that you once did. One of the things we know it really can impact the most is that the ability to work, and this is even post treatment, returning to work can especially be impacted. Also, your ability to maintain a specific role in the family, not being able to do the same tasks or activities that you once were. And then there's also the psychological problems that can result from it. So anxiety, depression, poor sleep. There's a lot of elements here that people don't necessarily think about when they think of fatigue. It's more the physical or the social elements, but there is a psychological component as well. Lisa, anything to add about that? Like when you were seeing patients, what did they say in terms of the impact? Was there a specific area that they felt was more impactful than others?
Well, I think, the biggest impact, I think, while you're going through treatment, I think there's always an excuse, whether it's the drug that you're on, it's the consistent having to go to clinic visits, it's exhausting. And I think that there's always these excuses that the patient and or the provider put on. I feel like once that treatment ends and you're trying to rebuild your life, that's when I feel like the huge impact of this cancer-related fatigue is really placed in the forefront, because you're trying to get back to your normal, and it's extremely difficult. And this fatigue, I feel like, is the biggest barrier. Like I said, it's like the ongoing side effect. It just keeps going. So I think in that transition, I see the biggest effect for people. There's no excuse anymore, in a way. But there is.
Really good point.
Huge one.
One element I wanted to bring up around fatigue is the fatigue score. And this isn't a common practice like we see with pain management, where, a lot of times you'll be asked, well, what's your pain level from 0 to 10? The fatigue score is used very much in the same way. And as I mentioned in the beginning about the definition of fatigue, it's incredibly subjective and it's different for every individual. And it's also different day to day. Right. So in being able to help others, especially, your family, friends, and especially care providers, in discussing cancer fatigue, it can be easier for people to really understand it. And Lisa, you made the point about being, hungry or starving, being able to put a number around it. So, you can be able to say today, I feel that my fatigue level is more of an 8 out of 10. But maybe tomorrow it's going to be a little bit better. But this is a way that you can measure it yourself, as well as being able to help others understand the severity of your fatigue as well. One thing I did want to mention, because we've said it over and over, is that there's so many individuals that experience it. And I wanted to point out that fatigue is most common, especially after that first year after diagnosis. So once treatment's been completed, that first year, there's a incredibly high incidence. So it's roughly, I would say it's more around 80 to 90% of individuals experience it. And there's also kind of long-term fatigue, even into kind of survivorship, and that often can last years. We estimate it's about 40% of individuals may experience it years after treatment has ended, and that can be anywhere from 5 to 10. I know we had the question, again, it being different for every individual. But I wanted to share that, in that it's a very common problem. We know it's the common side effect, but that there's millions of individuals, depending on where they are in their overall journey, that are experiencing this. And again, being able to utilize that fatigue score is a way to kind of put a number behind it. And Lisa, as a practitioner, how do you look at the fatigue score?
Well, that's the thing. I mean, I think it's something that we discuss through like interview, and less so much of like a 6th or 7th vital sign, so to speak. But it's so important. And I want to stress, that like, obviously you have a care team, but you're definitely the captain of your team. And so bring this up, because obviously I know for me as a provider right now, I'm thinking, okay, they've got a new fatigue score of 7 out of 10. Their naps aren't, I asked them, do you take a nap? Do they make you feel better? No, absolutely not. So also as a provider, it's triggering me. I need to, work you up for all of the above. I need to rule out anemia. I need to rule out any sort of recurrence. I need to rule out depression, anxiety, and it prompts that as well. And then once you get that workup done, and if and a lot of times it's the base of fatigue, then you're allowed to move forward. So it should be considered like an additional vital sign, in my opinion.
Yeah, thanks for that. And I will just highlight again the fact that all of you today who are wanting to learn more about fatigue, and that you're not alone, and that this is something that is a global problem that everyone is looking for further support from. And so just looking at the prevalence, again, over 40 million people when you just look at US and Europe alone. And if we're just saying 40% looking at long-term fatigue, that's 16 million people just in those two kind of areas that are suffering from fatigue. So again, the number one kind of takeaway from that is that you're not alone, and don't feel that this is something you have to kind of deal with by yourself, and that there's others and there are ways and support available. Kind of going into the factors around fatigue, this is one of the key questions, is what exactly causes it? And unfortunately, there isn't just one answer. It's a multifactorial problem, and that's why it's so hard to say that there is a specific kind of one size fits all solution, because it's different for every individual, and there's multiple factors that are playing a role in it. So we have this, I think, great image that really can help you kind of get a sense of, here's all the different areas that are influencing that fatigue. We just talked about the types of treatments. There's also comorbid conditions that can play a role. And then there's, of course, other, again, specific to various cancers related influences, as well as kind of there's physical elements. So Lisa mentioned anemia. There's also the side effects of medication. And then there's the psychological, social, and behavioral. And this is really where, for Tired of Cancer, this is where we focus, in terms of there is a key element here that you can be focusing on that has a direct correlation to cancer-related fatigue that feeds back in. So we kind of say there's a two-way street, in that anxiety and depression, for instance, can cause fatigue, and fatigue can also cause anxiety and depression. You don't necessarily see that with, say, like anemia. But one piece to highlight, and I think Lisa, you mentioned it, is just bringing up your fatigue to your care team. It is the number one thing to do, because they can better assess what other elements could potentially be addressed that may be contributing to that fatigue. So if you are anemic, being able to address that can help mitigate some of that fatigue. So having those conversations are kind of first and foremost, just to make sure that any medical causes related to fatigue could be addressed. Lisa, anything to add on this topic?
I think the thing is the key point is where the circle is that these are the things that you can take control on your own. And I think that is sort of like the empowerment of, I almost feel like fatigue just listening to us because like I feel like this is the empowerment part, is that these are the behaviors that you have can have the skills, if aware, to work on and take control on your own, and help improve your overall quality of life and your fatigue.
Yeah, that you may not be able to do something about every single one of those pieces, but you
Right.
can have an impact. Absolutely. Talking about the vicious circle again, and like how things can kind of compound on each other and make fatigue even worse. And this vicious circle kind of shows how the cycle of fatigue can develop, right? And that say you're not sleeping well, and so because you're not sleeping well, you're not going to be up for doing any physical activity, and because you're not very active, you may not, just be feeling great, and that you could be having pain, fear, and depression can result, and again it can continue in this, just what we say is a vicious circle. And the focus is looking at that vicious circle for yourself and saying, well, what are the areas that I may be dealing with, and focusing on how to, we say, break out of it. So if sleeping problems are a big issue, addressing that specifically so that you can kind of break out piece by piece, and focus on a particular area. I know one of the number one question, there's a lot of questions people have, but one of the key questions is, well, I have fatigue. What can I do about it? And so I wanted to share the potential treatments. And again, this is from the NCCN. This is the standards of care that have been published around cancer-related fatigue. So you see on both sides, we have the pharmacological side and then the non-pharmacological side. So kind of both sides are used in terms of addressing cancer-related fatigue. And Lisa, I know from a provider perspective, when you look at this, how is this used in when you have a patient that comes in and specifically talks about needing help?
Well, I think, as far as the pharmacological interventions, I do think there's specialized circumstances where those might work. But I will admit, most of the time, if I feel like I just don't know what to do to help, prescribing a psychostimulant, a lot of times my patients come back in and say, did you try to kill me? I feel like I've been having a heart attack. So they don't, it's based on evidence. They don't really work. And what really does work is a combination of all these non-pharmacological treatments. And we know they work. And it's just finding the balance for your individual patient or yourself that can most help and get you through the fatigue. And just understanding also the way these non-pharmacological treatments work is they help identify your behaviors that a lot of times we're just in the hustle and bustle of daily life. You have your oncologist telling you what to do. And it's sort of like just being able to identify behaviors that might exacerbate fatigue is really half the battle.
Absolutely. And I know every, hospital and cancer center is different, but a lot of centers have a support service available where you can look in and get more information on all of these kind of non-pharmacological options. And one that's especially kind of tried and true and tested and researched has been physical activity, where I know a lot of people say, but I'm already tired. How do you expect me to suddenly go and go out for a run? And it's not that so much as it's just doing some level of movement and doing what you yourself can do within what your capabilities are. But it may just be going for a couple-minute walk. So there's all of those pieces can really help in in mitigating fatigue, but I highly encourage everyone to look at what's available in kind of their own backyard, because I know, for instance, the Y has the Live Strong program, which is a specific program for cancer patients and survivors to be active. And it's, again, at a local level, it's different wherever everyone lives, but there are resources available that very much fit in with that non-pharmacological side. One of the things we wanted to share with you today is what our founders created, and that is the Untyre program. And so Untyre was developed by Dr. Bram Kuiper in the Netherlands. He's a clinical psychologist in oncology for the past 30 years. And he's been working with patients in a variety of different settings. And he found that a lot of online interventions were working really well. And that kind of created the idea for, why can't we just put this into an app form so that everyone can get support? So that's very much why Untyre was born, in that putting together a lot of the cognitive behavioral therapy, a lot of the education and activity, kind of combining everything we just reviewed on the non-pharmacological side into an easy to use tool that people can use, whenever they can, and whatever it suits their schedule, or some days are going to be harder than others. So that was very much what the entire program, or why it was developed. And the program itself is kind of broken down into 4 segments. I don't want this to sound like a commercial at all. This is our focus is that we can help support individuals and help you find a way to get the support you need. So just wanted to share a little bit about the program, but more importantly, tell you about some of the exercises and things you can do today to start working on your fatigue and seeing improvement. But as I said, the program has 4 pieces. So you have the physical activity recommendations, there's education. So talking about all the various elements that play a role in fatigue. As I mentioned, it's nutrition, sleep, anxiety, fear of recurrence. Those are all elements. So we just got a question in the chat. What app is this? The app is called Untyre. And I know Amy mentioned at the beginning, we have access codes available to anyone on the call today that would like to try it. It's, again, the focus being that we're just trying to help those, especially here in the US, know a little bit more about fatigue, and that there's the app to help support them. Our bigger focus with the program is that we're trying to work with health insurers and hospitals so that they can incorporate this into their care treatment plans. Obviously, that's a long road ahead, but we're kind of working on it step by step. I hope that answers the question. So one of the key elements, and this ties into the fatigue score that we had shared earlier, is the ability to track and measure and understand, behavior, understand yourself, and look at everything kind of day by day. We have something called the Vase of Energy, and it's really a great tool to kind of think of your energy in so many ways. But one of the key elements we found, especially this app's been used by over 30,000 people around the world, is that week over week being able to measure and quantify and say, this is how I was feeling this week. This is what I did. It's providing insights for yourself, but then it's also something that can be shared, like as Lisa mentioned, with the care team, so that you're being able to see what's helping kind of give you energy and what's taking energy away. So I think the best way right now is to kind of do this energy measurement as a group. And of course, we appreciate any feedback on this, but everyone taking a step back and saying, okay, if I had to give myself a score right now, what would my energy level be today? and then thinking about, well, what are the things that give me energy and what are the things that take energy away? So, um, Lisa, I know you personally have a really great analogy, just as someone who's, completely moved to a new setting. You were even seeing your energy levels change.
Yeah, no, definitely. Well, I think the thing is that, we see like obviously the adding energy, you see your grandkids or you see your children, you have a great conversation, that goes up, draining energy. You have to go to the grocery store because you forgot milk or something, and those are fine up and down. But I think what I want to focus on is the leak. And that's what I find so valuable is in recognizing your own energy levels, is that for you, especially with a cancer diagnosis and going through treatment, et cetera, you have a leak, and that's always going to drain your energy. So for me, I'm not trying to equate this to any sort of diagnosis, but for me, just moving to the Netherlands, I can't practice here until I perfect my Dutch. When I first moved here, I have to read signs. I have to either translate them in my head or whip out my Google Translate and figure it out. And at the end of the day, I found myself like, oh my gosh, I'm as exhausted as I was working in the hospital. And why is that? And when I really sat down, it's because it's my leak. I don't speak Dutch. I'm not from here. And I'm trying really hard to acclimate that. And that drains energy, even if I don't realize it. And so that's the thing. You all have a leak. So as much energy that you put in and as much it drains, just respect the leak and know that it's not your fault. And what can you do to sort of kind of not make up for it, but sort of help it out in a way. I think it's just sort of like the validation of the fatigue and then the realization that you're going to start a step behind someone else. I think really helps in the long run mentally and overall.
Yeah, absolutely. And I think the analogy again, just you can pour all this water into your vase, but if you don't address the leak, then you're still not solving the problem, even though you may be putting all of those, all that energy into it. Um, it's also a great way to get to know yourself, right? And what can be what's been giving you energy, what is taking energy away. It's through that process really being able to then understand your leak. And I know a lot of patients have shared, fear of reoccurrence is one that can be especially a leak issue, because with getting a new scan or just having all of that anxiety and stress related around one particular moment in time coming up can be especially draining. So we always like to ask, as a group, as you're looking at this slide, thinking again, kind of that self-reflection of, what do I know can give me energy? What is taking my energy away? And especially in those moments where you are drained, being able to kind of almost go into your back pocket, so to speak, and say, well, I know I can kind of do a few things maybe that can help me be a little bit more rejuvenated. Um, if I have maybe something in the afternoon. One of our wonderful colleagues, Yella, he's a two-time cancer survivor, and he does a lot of different breathing exercises. And we would, even just in a work environment, if we'd be working all day, he would go and take 15 minutes and do a meditation or a breathing exercise, so that he could go out to dinner with his friends later on, because he knew he had to kind of conserve but also add a little bit more energy so that he'd feel better off in the evening. So just kind of an example there of finding those ways that you can add more to your base. So tips for better energy management. I think these are ones that, again, no matter who we're talking to anywhere in the world, we've gotten feedback that they're really some of the kind of tried and true elements. Number one, validating that it exists. Again, you're not alone. This isn't something that, that isn't made up. It really is something. Prioritizing and planning. This is definitely an area that we've heard from a lot of patients. So kind of being able to, keep in mind, certain days are going to be easier than others. Some days may be harder than others, but being able to kind of divide those tasks accordingly, prioritizing what needs to be done and what can be done by someone else. So really being able to lean on others to also tackle things on your to-do list. Lisa, feel free to jump in. So it's not just me talking.
You're doing such a good job.
So
No.
I think feel free to jump in.
I think we
and do
know
the
what you
rest.
meant, but taking the breaks to add energy. I mean, I know like a lot of these things seem silly, and but they're really not. And I know Amy had mentioned earlier that this isn't like a commercial. You can take the things of the ingredients of the app. So basically, the app is all those ingredients of the non-pharmacological treatments that we know work, and they're all together. It just makes it. For example, I think of, I used to give my patients binders when they were first diagnosed, and it had all these resources and all this patient education and this patient information. But personally, I know my mom I've lost both my parents to cancer, also my sister. And I know those binders sat on our bookshelf. And with this, it's sort of like something that you can have in your back pocket. And you can pick and choose which of these non-pharmacological treatments work good for you. So whether that's like what Amy said with Yella, taking a break, taking a deep breath, maybe leaving work an hour early, maybe saying no to people. That's huge. Saying no to the last Zoom call, or saying no to a family visit. I know it's a different world we live in right now with the pandemic. So just things like that can add energy, and then just sort of recognizing who you are, what's your leak, what really tires you. In nursing, we always say, if you don't document it, it never happened. So it's just sort of taking that control of your own life, and just hopefully being able to kind of be the captain of your care when it comes to fatigue.
Yeah. And I think lastly, it's talking about it, right? I know a lot of patients have said, no one seems to get it, and you don't get it unless you've gone through it. And the number one thing we can recommend is talking about it. And like we had shared, the fatigue score, being able to quantify it can help others get some sense. But again, they'll never truly know. But especially talking with your care team, with family, friends, that they understand that this is something. And hopefully, again, your care team can look at any other medical issues that could also help resolve some of it. But first and foremost, letting them know that this isn't something you have to silently deal with, and that the more others understand, the more they can also be of help. So with that, and I know we've talked a lot, and I know sitting here for 45 minutes isn't isn't a lot of fun in so many ways, and hopefully you're not more fatigued after sitting here, and hopefully this has been able to give you a bit of energy and a bit of some tips and advice that you can use walking away from this. But wanted to open it up for questions, and feel free to put in the chat, or just jump in if there are any questions. I did add a couple to the presentation, just ones that we tend to hear a lot about, but just wanted everyone to feel comfortable in asking any questions they may have, and certainly appreciate everyone's time and attention today, because we know, especially when you're tired, just sitting in a presentation can take some energy.